Helping Seniors TV program host Kerry Fink talks with Valerie Clark with Eye Clinic and Laser Institute about how they help with LASIK, cataract surgery, and general eye care. I'm Kerry Fink with Helping Seniors TV, and what a great day this has been. We're on location at the Mega Senior Expo. That's taking place here at the Melbourne Auditorium in beautiful downtown Melbourne, Florida. And so we've been having a great day. It's been a very well-attended event. Really a lot of good information. We've had something like 70 to 80 different vendors and information tables. So there have been hundreds and hundreds, I think someplace between 600 and 1,000 seniors have been through the doors today to get information that will help them in developing their own aging plan. And so we've had the pleasure throughout the day of visiting with various people who have been part of the event. And today I have the privilege of sitting with Valerie Clark. Hello, Valerie.
Hi,
how are
you?
you?
Good,
Good to see you. And you are with the Eye Clinic and Laser Institute.
That's correct.
We were talking about this because you're in multiple locations throughout Brevard County. You have 4 different locations. We're going to go into all that, but first I want to ask you a little bit about you and your background and how you came to be in the eye clinic and be working with that group in getting the word out about the good things that you guys are doing.
Well, thank you. I started here in Brevard County working for a durable medical equipment company back in 2007. And I did that for a few years, selling respiratory products, getting to know the medical community. And then I morphed that job into home care sales, which I really, really enjoyed. And I did that for over 6 years with a very small mom and pop company in town. Unfortunately, that company was purchased,
right,
and it was time for me to move along after that. So after dabbling at a few different type of medical sales jobs, I found this. I like creativity, and so this has a little more of a marketing spin. Versus just sales.
Right.
But I have all the contacts that I've made over all the years.
Right.
So.
Well, and clearly you have quite a background so you understand all the issues that seniors are going through because of your background, both as you said, with durable medical equipment, and then also, in working with seniors in their homes. So you really have the benefit. You bring a lot to the table because you really understand what seniors go through, and that puts you in a unique position to be able to help them when it comes to thinking about eye health and eye care and things like that. So it's probably opened up a whole nother level for you in terms of creating value so that people know about the good services that you guys do there at the Eye Clinic and Laser Institute. Tell me a little bit about all the range of services, because you guys really are full service. So you cover everything from A to Z with it, right?
That's correct. We are a complete eye care center. So we have opticians, licensed opticians, so you can have your contact lenses and glasses taken care of with us. And then we have 3 medical doctors, ophthalmologists, and they perform surgeries, cataract, glaucoma, LASIK. We have bladeless laser cataract surgery as an option. So really the full gamut from surgery down to contact lenses.
So this can start as simple as somebody coming in saying, I think I need to get my prescription updated and get better glasses or something.
Correct.
But then, as I understand, part of the benefit is if somebody gets in there, they're having an eye exam, there's more complicated issues, you're able to work with that all in-house.
That's correct. That's correct. And we have multiple locations, as you mentioned. So, we're really convenient for wherever you live in Brevard County.
Yeah, where are your locations? I know you said Merritt Island.
Yes, Merritt Island is our main location, and Dr. Agarwal has owned Eye Clinic and Laser Institute since 1980.
Wow.
So he's been there for a long time. We also have a new location in Port St. John.
Okay.
That just opened up at the beginning of March. And then we moved from Vieira to Suntree back in August, and that's in the Medical City Plaza. And we also have one here in West Melbourne on South Wickham.
So you really have everything from Central Brevard to North Brevard well covered, and even from Palm Bay, it's not much of a hoof to get up to here.
We're not too far past that.
So somebody could come to whatever location is convenient with them, just get established, and then start working. But particularly with seniors, you had mentioned that it can be very valuable, particularly, for example, people with diabetes and things like that. It becomes important for them to get a more advanced look at what's going on to be sure everything is safe. Is that right?
Correct, correct. That type of patient, especially somebody with diabetes, should have an annual eye exam, a complete full exam, dilated eyes, and that way it allows us to monitor them over a course of time. So if we start to see any changes, we can get on top of it before it becomes an issue.
So I know your work is getting the information out into the community so people are aware of the services that you guys do. What are some of the tools that you find are helpful in getting people educated as to the benefit of what you guys are able to offer?
Well, our physicians actually really enjoy community education, so as often as I can, I try to sign them up to provide seminars and lectures with senior centers or at nursing facilities, pretty much anywhere I can find the venue for them to do that type of education. Something like today,
Yes.
being at this expo, it's a great way to see a lot of seniors in a short amount of time and get all of our information out there. I also like to advertise in the papers, and we're starting to try to do some more social media. We'd like people to like us on Facebook and leave reviews on Google and Yelp and whatnot. So.
Well, you've been around for, let's see, you said 1980, right?
Mm-hmm, yes.
So this is like terrible with the math, but I mean, you guys have been here for quite a few years doing this and have really established a reputation for doing this with excellence. How do you convey that to people? Like if somebody says, okay, I could go down to, whatever local thing in the mall, somebody might say, well, but it might behoove you to take the extra step and come over, which is just as convenient because there's 4 locations. Why would somebody say, or what would you say to somebody and say, this is why this would really be of value for you?
I guess what I would say there is that we have ophthalmologists, which are medical doctors, and so there's a greater depth of knowledge when it comes to all the different things that they check. We were talking to somebody today about how her physician, her ophthalmologist, found a carotid artery issue.
Oh wow!
And saved her life.
Wow!
So there's so many more things that are involved than you could get at just a walk-in mall situation.
Now, before the cameras were rolling, we were also talking about the fact that you guys you're adept at treating not just seniors, but you're really used to seeing entire families. You said everybody from grade school children to seniors.
Yep.
And I'll bet a lot of times, particularly that you're going to see a multi-generational family. In fact, it's amazing, actually, some of the statistics in Brevard we like to quote is that 1 out of 2 people in Brevard, by AARP definition, is a senior, meaning they're 50 plus.
Right.
And then 1 out of 4 people is actually over the age of 65. So depending which version of senior you want to call it, there's still a lot of seniors when you come down to Brevard County. But one of the interesting statistics was the number of parents or grandparents, I guess it would probably be, over 65 who are raising school-age children. So I bet you see a lot of people coming in that are interesting family blends, but they all have the same thing. They want to make sure they're having good vision.
Yes, that's true. And I'm going to fall into that category as I've had some children later in life, so that will be me someday. But
That's good.
Yes.
That's good. It's a good thing. So with helping seniors, I was going to ask, we try to come to these kind of events, and we're really blessed to be here because this has been a phenomenal event today. Lots of people here. But one of our objectives is to get out in the community and reach people because, there is the statement, people perish for the lack of knowledge. A lot of times they're just one point of information away from a solution that's really going to assist them. And so we find it's really helpful to get out here and meet people one-on-one. And I was going to ask you for what the value you guys find for being at community events like this. What's helpful for you guys?
I think just what you said, the one-on-one conversations. I go into senior centers or other physicians' offices, and, I have opportunity to talk to people, but here they come with questions.
Sure.
And I actually brought one of our technicians along so that she could answer clinical. One of our physicians stopped by over the lunch hour.
Oh, wow.
So it just gives us an opportunity to be personal with them and, answer questions for them. And
that's good. That's good. So with helping seniors, we actually are a not-for-profit organization. So there's actually 3 things that we do. We were founded by a gentleman named Joe Steckler. Joe is a retired Navy captain. He retired. His last command in the Navy was he managed the Navy's retirement home in Gulfport, Mississippi. He had something like 550 different residents under his care there, and they had a hospital. It was like the full deal. So he retires from the Navy, can't stand being retired, comes back to Florida, and starts the Alzheimer's Foundation because he has a serious passion for seniors. So after he got that, built Joe's Clubs, all those things, he begins another organization called Helping Seniors Brevard because he said, Kerry, people, not the only issue that we have is not necessarily with memory, but we have other issues, and we got to address them for seniors because they need to get a place for information. So we really focus on doing that. And one of the questions I have for you is just, what are the ways that we can work together to get good information out to seniors of like tips and things that you mentioned you're doing a lot with social media. We should find ways to work together to get information out to seniors that are going to have good value for them and improve the quality of their lives.
Yes, and I was asking a lot of people today actually about the social media thing, and do you go on Facebook? And
sure.
I got mixed answers there. Even I fumble around with
sure.
social media a little bit.
Sure.
Give the
sure.
Computer to my 16-year-old, and
right. I get it.
we're good. But yeah, so it's kind of a mixed bag with that, which is why, like I said, we try to cover across the board with advertising.
It's a funny thing. Multimedia, Joe Steckler has done columns in almost every newspaper. We're in Hometown News a couple of times a month. We're in the Senior Scene magazine, and always trying to, Joe, and Spotlight magazine. There's all kinds of Aldea Today, Ebony News Today, Space Coast Daily, all these different places. They like to pick up Joe's articles because he's always talking about stuff of relevance to seniors, and that's the point, is people will be touched by something along the way, and there are the growing number of people using social media, and so there's a very strong presence for us there too. But that's why we do the TV, that's why we do the radio, and all those different things to get the word out. And it's really good to hear about the work that you guys are doing, helping seniors get better vision and safe better vision. That's really part of it as well, isn't it?
Definitely true.
So how would people best get in touch with you? Is there a website that they should visit?
We do have a website. It's www.youreyeclinic.com. Again, we have a page on Facebook.
Yeah. And what's that page? Do you remember off the...
I don't. I'm sorry.
Okay.
But if you just go into the search bar and type in Eye Clinic and Laser Institute, it will pop up.
That sounds wonderful.
The one thing I didn't mention, and I don't want to forget to mention, is that when patients do surgery with our physicians, it's done in our Merritt Island Ambulatory Surgery Center. We have our own surgery center. And on surgery day, if they don't have a ride, a spouse, a friend, somebody that's able to get them there and home, we offer a free service for that.
Oh, so you can get them to the surgery and probably more importantly after the surgery, so everything is safe and correct with that. That's good to know.
Yeah, I think that's really important. So.
Oh, good. Well, Valerie, I sure do appreciate you taking the time to sit with us today and share a little bit about what you guys do, and thanks for being part of Helping Seniors.
No problem. Thank you for asking me.
Thank you.